Hello everyone, I am Dr. Ankur Gupta. I am practicing as a consultant interventional cardiologist at Mediterranean Heart Center in Civil Hospital, Panchkula. Today I will be discussing about heart attack. On the World Heart Day, the objective of our talk today is to understand about heart attack, its causes and preventive measures which can avoid a heart attack. Knowing this will help us to take right steps towards strengthening the heart health. Nowadays, incidences of heart attack and the number of deaths due to it are constantly increasing in India. Thus, let us understand what is heart attack and what can be the reason behind it. The heart is the most essential organ and its non-stop functioning is critical for our survival. It functions as a pump and allows the circulation of blood throughout the body. Any interruption of blood or oxygen supply to the heart because of blockage in blood vessels for even a few seconds can impair its function and lead to heart failure or heart attack. The main reason behind such incidences is increasing blood pressure and excess cholesterol and fat deposition in the blood vessels. Persistent high blood pressure damages the blood vessels by making them more rigid by damaging their inner walls. This increases the risk of cholesterol or fat deposition in blood vessels. When there are excessive fats, it gets deposited in the inner walls of blood vessels, which blocks the blood flow. The increased demand and low blood supply and the low supply of oxygen due to these blockages ultimately leads to failure of heart function. A heart attack may cause multiple symptoms and can be different for each person. A person may have just one or combination of these symptoms. This can feel like numbness, squeezing, fullness, or pain in your chest. This discomfort can spread to your arms, neck, jaw, or back. However, it's not the only symptom possible of a heart attack. There are few other symptoms that can be present in heart attack, which are like dizziness or fainting, or feeling of lightheadedness, nausea, indigestion, vomiting, shortness of breath. If one can reduce their risk by making positive changes to lifestyle. So here are some of the changes that one person can make that can cut the risk of heart attack and put you on the path to a healthier life. Eating a heart healthy diet is one of these features that we can have. A healthy heart diet emphasizes an increased intake of fruits, vegetables, whole grains, poultry, fish, and nuts, while curbing sugary foods and beverages. We have to eat more fruits, vegetables, whole grains, and other high fiber foods. Vegetables and fruits are also low in calories and rich in dietary fiber. Vegetables and fruits, like other plants or plant-based foods, contain substances that may help prevent cardiovascular disease. Eating more fruits and vegetables may help you cut back on high-calorie foods such as meat, cheese, and snack foods. So foods higher in saturated fat can contribute to high cholesterol and reduces blood flow and increases the risk of heart attack in an individual. Hence, it is also important to start a heart healthy diet to reduce the risk of heart attack. We have to limit foods which are high in saturated fat, which comes from animal products such as cheese, dairy, desserts, tropical oils, and highly processed foods. We have to choose unsaturated fats which don't raise cholesterol levels. One can find unsaturated fats in foods like nuts, fish, vegetable oil, olive oil, and sunflower oils. We have to cut back on our salt intake. This is especially important for people who are at risk for or already have high blood pressure. One should try to limit how much sodium one is eating. It should be less than 2300 milligrams a day. This can help lower the blood pressure. If one has high blood pressure, one has to limit the sodium intake to less than 1500 milligrams a day. One can lower the blood pressure even more by cutting down on daily salt intake. Choose and prepare foods with little or no salt, and one should watch for hidden sodium in the processed foods that we are taking. Following an exercise plan and maintaining an ideal body weight is another point that is important in maintaining healthy heart health. Regular physical activity makes heart stronger. Regular exercise can help one in burning calories, lowering high blood pressure, reducing LDL, that is the bad cholesterol, and boosting one's HDL, that is good cholesterol. Aerobic exercise is recommended for good heart health. Running, jogging, and biking are some of these examples. Stop and get immediate medical help if you have pain or pressure in your chest or upper part of your body, break out in a cold sweat, and have trouble breathing while performing any of these activities. If you have joint problems, choose a low impact activity like swimming or walking. One can aim to get 2 hours and 30 minutes of moderate aerobic exercise per week, like brisk walking, or 1 hour and 15 minutes of high intensity exercise, just such as jogging per week. One of the other important factors is to quit smoking and limited alcohol intake. Quitting smoking and drinking too much alcohol can raise blood pressure. It also adds extra calories, which may cause weight gain. Cigarette smoking also raises blood pressure and puts you at higher risk for heart attack and stroke. Reducing these factors can help to reduce further complications. One should also manage the day-to-day stress levels. Managing stress is an important factor. In fact, managing stress levels and getting adequate sleep are also possibly the best ways to prevent heart problems. Overall, it is possible to make healthy heart and prevent heart failure or heart attack through lifestyle interventions like dietary modification and exercise. By taking action to lower blood pressure, one can help protect themselves against heart attack. Thank you.